Hello, good morning everyone. I hope I am clearly audible as well as visible to all of you. Uh, Good morning. I'm Dr. Niranjana Raj. I'm consultant dermatologist as well as hair transplant surgeon. I work in the Bangalore branch of Dr. Yogiraj Center for Dermatology and Cosmetology. I also work in the Kerala branch, which is there in Trivandrum. Now, today I'm here before you to explain to you how to take care of your skin as well as your hair during this period where you're undergoing a lockdown. So now we are having time aside from our busy schedules. We are practicing social distancing. We are locked down with our family, taking care of each other as well as our own health. So this will be an ideal time for you to spend a bit of time for your skincare regimen also. Now there are a few points which I'd like to elaborate. First thing, all of us know how to do hand washing now and how important this is. So WHO has given us the guidelines that we should do hand washing at least for a duration of 20 seconds using soap and water. Also, alcohol-based solutions with at least 60% alcohol is also important to sanitize our hands. Now, one problem we dermatologists see very commonly nowadays is severe dryness of hands, itching, irritation, scaling, and some people also come to us with oozing, crusting, and hardening of the skin in the palms. Those are the people who have a history of hand eczema or hand dermatitis. Now, it's always better to prevent this than to find a cure for this. So, in order to prevent this, better to use a moisturizing cream, something which is like a thick moisturizing cream every time you wash your hands. So, make sure you're keeping your moisturizer right next to where you're doing your hand wash. And every time you do your hand wash, diligently moisturize your hands also. This will prevent dryness and irritation of skin. But in case you are noticing more amount of irritation, if itching is there, red rashes is forming, or if there is oozing, crusting, or thickening or cracking of the skin which is happening, I would recommend that you consult with your regular dermatologist who will be able to guide you in further management. And mostly nowadays all the dermatologists are available on online platform, so better to use this opportunity and get in touch with your dermatologist. Now, it's not just your hands, you have to take a full care of your body also. So your diet is also very important. It's important to hydrate yourself well. So hydration means at least try to take at 7 to 8 glasses of water a day. If you are able to, please drink at least 2 to 3 liters of water a day. So also include water rich diet. For example, if you are taking cucumber or taking salads which contain tomatoes, radishes, those will be good. Also improve in your diet through citrus fruits and more amount of watermelons and all, which will hydrate yourself. Try avoiding beverages which contain highly sweetened beverages or preservative containing beverages and take water instead. Okay. Not just this, our diet should also be very healthy. Try to take wholesome food, fiber rich diet, more of fruits and vegetables. Try to avoid taking sugar laden diet or fat rich diet. And as immune boosting diet also is very important during this time. So in case you can include more of zinc based elements in your diet, for example pumpkin seeds, sunflower seeds, or egg yolk is highly rich in zinc, and zinc is also known to protect us against viruses, so that would be good. If you are able to increase more of vitamin C in your diet, for example, vitamin C comes from citrus fruits like oranges, lemons, or even kiwis, strawberries, etc., and papaya also. All of this will help to improve the vitamin C in the diet. And in order to give more of immunity, I would also suggest, if you can take it, take a vitamin C tablet also. 500 mg vitamin C tablets are easily available. Even dispersible tablets are available of vitamin C in mostly orange flavor or lemon flavor. If you put it in a glass of water, it disperses to form a juice and you can take it also, and that will help in boosting the immunity. Also a selenium rich diet. For example, if you are taking organic meat or eggs or even garlic, onion, broccoli, everything is rich in selenium. That also will help to boost up your immunity. So all this together will not just improve your gut health, it can also give you a beautiful glow on your skin. And it is important that when you're sitting at home, you're consuming a lot of food with very little exercise. So I'll also just suggest for you to get a bit of exercise. If you're staying in a flat which has a campus, practice proper social distancing, but try to walk around the campus, or Even online, there are a lot of applications which provide home workouts, and if you're doing it, that also will help to maintain a very fit body. Now, the most important thing I'll come into, for example, how to take care of your skin. Now, skin, there are four main points I'd like to elaborate. One, how to cleanse your skin. Second, how to moisturize. Third, how to use sun protection. And fourth, to incorporate a skincare regimen like a serum and a night care regimen. Now, the most important and the first point is cleansing. Now, cleansing the skin and the cleanser which you should use depends on your type of skin. Mostly, I'd suggest that get the cleanser recommended by a dermatologist. For example, if you have a very dry skin, patchy skin, stretchy kind of skin, I'd suggest don't use soap. Definitely don't use a soap on the face. It will strip your skin of all the natural oils. Try to use a mild, gentle cleanser which is fragrance free, and that will protect your skin and keep it supple. Second, if your skin is oily, better to use something which will reduce the sebum production of the skin. And thirdly, if your skin is more acne prone, better to use a cleanser which contains salicylic acid or antibacterial ingredients which will decrease the acne, and all the bacteria in the skin also reduces, so it will help to dry up the pimples. And if your concern is more about pigmentation, better to use some face wash which contain glycolic acid and salicylic acid, which will help in removing the pigmentation also. The second thing is to use a good moisturizer. So moisturization is very important. It depends on the type of skin again. For example, if your skin is already very oily, I'd suggest, okay, you can avoid using a moisturizer. But in case your skin is again dry and stretchy and irritated kind of skin, better to use a moisturizer which is a bit thick, which contains ceramides, which contains hyaluronic acid, which will give a good protection to your skin and make it smooth and supple. Now, if your skin is more of acne prone and if you have blackheads and whiteheads on your skin, I'd suggest please avoid using moisturizer, or in case you're using moisturizer, preferably use a lightweight moisturizer, water-based moisturizer, gel-based moisturizer, which won't be heavy on your skin and won't clog your pores and trigger out more of acne. Now, this is a kind of moisturizer to use. The third and the most important point is how to use a sunscreen. Now, sun protection, I'll say it's absolutely mandatory in your regular routine life. I always say to my patients that you should use sunscreen just like how you are, brushing your teeth as such. So you have to apply sunscreen at least 20 minutes before you get out of your house and reapply one time more during the day. So reapplication means at least every 4 hours. The reason is even though using a high SPF sunscreen like a SPF 50 plus sunscreen, the sun protection factor keeps on decreasing every hourly. So by the time if you have applied at 8 a.m. in the morning and by the time you reach 12 o'clock, you are no longer protected. So it suggests at least you use at 12 and then reapply again at around 4 p.m. for more better protection. So sunscreen is mandatory. And now a lot of patients do come to us telling, ma'am, I'm staying inside full day, I'm not going out, I'm traveling by a cab, I don't get any sun exposure. When I'm sitting in office also, I'm not getting much sun exposure. So what is the requirement to use a sunscreen? See, one thing is to understand is when you're staying indoors, definitely a bit of sun rays does come inside. The light fitting in the room also has UV rays, and our window panes in the house can filter out UVB, but it can make the UVA radiations come in, and this UVA radiations can penetrate into the deeper layers of skin and also causes a bit of photo damage. It can cause sunspots, dark pigmentation, dullness of the skin, and it can even cause early aging signs like wrinkling. Now, nowadays, since we are at home, one more thing we are very commonly doing is we are using a phone a lot, we are using laptop, we are using iPads, we are watching television a lot, and all these devices emit a visible blue light as well as infrared light, and this radiation also irritates the skin and causes skin pigmentation and visible signs of aging. So all these factors should be avoided, and this is the importance of using sunscreen. Even while we are cooking also, we are exposed to a lot of infrared radiations, and that also leads to a dullness, and aging properties of the skin can be aggravated. So this is the importance of using sunscreen. So mandatory, try to incorporate it. Now, also at this point of time, although the three main portions are covered, I would like to tell that if you can incorporate a skincare regimen, depending on your skin type and your concern, it will be really good. For example, if you have a pigmentation problem, you can start using a serum or a cream which contains active ingredients like vitamin C or glycolic acid. In case you are having an acne issue, you can have a cream with active ingredients according to what your dermatologist is prescribing, or dull dry skin, creams with anti-aging ingredients or retinol containing creams for anti-aging properties can be incorporated at this time, so that by the time we come out of this issue, at least we are taking care of your skin and set into a good routine. So these are the main points. So also one few more things I'd like to say is, other than the hand dermatitis, we are seeing a lot of people coming exacerbation of acne. They're consulting us online, telling our acne has exacerbated. We have not gone out. We have not gotten exposed out to dust, pollution, etc. So some of the factors, maybe stress would have been increased. Maybe our diet would have changed. We are at home, maybe sitting in front of the TV, we would have consumed more of junk food. Hormonal changes can be there. We are not washing our face as diligently as we used to before. We are not going out, so maybe we have slept without taking the grime off the face. So all these factors can lead to an exacerbation of acne. So it is important that you consult with your dermatologist and get into a skincare regimen by washing your face, use the proper moisturizer, and using the proper ingredients for according to your dermatologist for your type of skin. Also, better not to scrub your face, and not to use any face packs which can create this problem also further. And also, please improve your diet, reduce milk or milk based products in your diet, try to reduce sugar in your diet, and incorporate a bit of exercise. All this will help to bring your acne under control. Now, we also see a lot of people coming with increase in dandruff. Now, this is a problem which is there because we are at home. Mostly we'll say think that it's not important to get a regular hair wash. So I'll suggest at least take a daily hair wash. If that is not possible, at least alternate day hair wash. That the secretion will be there, dust accumulation will be there, and it will cause the fungus or the dandruff to come into your scalp. So in order to combat this, use a mild cleanser, cleansing shampoo which is SLS free and parabens free daily, or you can use a mild anti-dandruff shampoo again in order to combat this. But in case you have the thick kind of dandruff which you feel like scratching out with your nail, then better to consult the dermatologist itself. Now, one more other issue we see very commonly is increase of fungal infection, which is very rampant. And nowadays you are at home, so maybe you're doing home workout, wearing tighter clothes at home, or you're not washing your body as regularly. So I'd suggest please take a bath daily. If you can manage at least 2 times a day, also you can take a bath. And you can even make sure that your underarm area or groin folds and all the fold areas are kept dry, and wear some cotton and loose fitting at home, so the sweat doesn't accumulate and it can't aggravate the fungal infection. So these are a few things I'd like you all to follow. And to recap, the importance of using moisturizer while washing your hands, and the importance of having a healthy diet with wholesome foods, with fruits and vegetables, increasing your water intake, and improving your skincare regimen with a cleanser, with a moisturizer, with a sunscreen, and also using an active ingredient at night in order to combat your skincare issues. So, and now I'll be open to answering a few questions. So, let me see. So, anybody who has any questions can keep putting it. Good morning, everyone. So one question from Mr. Suresh is, what is the SPF you recommend for summer? So the minimum SPF for the Indian skin, that I would say is minimum SPF 30 plus. If you are staying mostly indoors, that would be enough. But in case you're going out, you're getting a lot exposed to the sun and all, minimum of SPF 50 plus. The difference between the SPF 30 plus and 50 plus is that that lasts a bit more, so you don't need to reapply so frequently. Now it is also recommended to use a sunscreen depend on your type of skin. For example, if you have an oily skin or something skin with pimples, better to use a gel based sunscreen which doesn't clog your pores. Also, reapplication of the skin sunscreen is very important. And also for summer, I mostly suggest SPF 50 plus, and if you're going out a lot, better to use SPF 50 plus. Ms. Nandi has asked how good it is to use a derma roller. Now, derma roller we use in our regular skin practice, whether it is to take care of skin scars or whether it is to along with a mesotherapy session or using PRP or plated plasma therapy in order to stimulate hair growth, because micro wounding will induce more of growth factors and wound healing cells will come onto the scalp, which will help in repairing the hair and also to reduce the hair fall. So derma roller use is good, but I really suggest it for home care use. In case you are utilizing it for home care, it will be a bit painful. So better use a derma roller with a very small like 0.5 mm on the scalp in case you really want to use. But I suggest get it done with a dermatologist itself, because they will follow all the standard safety protocols, and as well as they will maintain it very sterile. Now Sapna has asked how much sunscreen should I apply. Now sunscreen should be enough, a pea-sized amount is enough to cover the full face, but in case you want to use it on the full body, an ounce of sunscreen will be required. I'll suggest use a most cosmetic type of sunscreen, more of a matte finish or gel based sunscreen for the face. It will be more or less on the expensive side. For the body, because we are covering larger surface area, better to use a moisturizer based sunscreen or a moisturizer which contains a bit of SPF over the larger areas. Now one question is, should I apply oil to the hair regularly? So I don't suggest that you should apply oil to the hair. In fact, oil will aggravate dandruff also, so don't apply to the scalp. In case you are having like very dry hair, better to use a conditioner instead. Or in case you are very much adapted to oil and you can't be without it, I'll suggest use it on the tips. Don't use it on the scalp at all. So I don't recommend oil use at all. Okay. Now Mr. Suresh is asking, can you suggest some home remedies for hair fall? Now see, hair fall, it is multifactorial. There will be a lot of factors. See, hair fall, we say when greater than 50 to 60 hair is falling in a day. So regularly up to 40 to 50 a day is considered normal. Now if you have hair fall, it can be a lot of factors like stress, water change, climate change, vitamin deficiencies like vitamin D, B12 deficiency, iron deficiency, thyroid imbalance, etc., which is leading to your hair fall. So ideally we should check for any underlying and treat it accordingly. Some even high fever like typhoid, dengue, malaria, chikungunya, all these high fevers can also cause hair fall. But see, hair fall is not to be worried about. When hair falls, a new root comes from that point again, because there are stem cells below the level of skin which is on regenerating new roots. So don't get worried regarding it. So I suggest that don't get stressed. And what you can do is improve in your diet. You're asking for home remedies, so I suggest you to improve your diet with more of B12 rich diet, especially if you're non-vegetarian. You can include more of protein rich diet also, and also iron rich diet. Iron rich means like curry leaves, spinach, dates, pomegranates, etc. I would not suggest oil scalp at all. And you can use shampoo and conditioner which is recommended by your doctor or dermatologist. Preferably use a chemical free or SLS and parabens free shampoo and conditioner for hair fall control. Also, if you consult with the dermatologist, most probably there are a lot of excellent peptide serums which they would suggest, which you can get a recommendation for. For home care, I guess you have to improve in your diet, and always better to rule out any underlying factors. Mr. Dinesh is asking, does sunlight trigger melasma? Yes, melasma is mostly, it's a genetic kind of pigmentation which can get aggravated, or the pigmentation can become more darker when exposed to sunlight, definitely. UV radiation can stimulate the multiplication of the pigment cell or melanocyte in the skin, and that can make the melasma look darker. So along with the skincare regimen, what your dermatologist prescribes, definitely you have to mandatorily use a sunscreen at least 20 minutes before going out, and reapplication is also important. Now, Mr. Tushar is asking, is there laser treatment for hair growth and hair graying? Now, yes, there is laser treatment for hair growth. There are options like laser comb and laser helmet. It is a pretty simple procedure. In case the dermatologist or the clinic nearby to you has that option, I'd suggest you can visit there. It's just a matter of keeping a laser helmet over the scalp, which is the laser radiations are known to stimulate the stem cells and will increase hair growth and stabilize the hair fall. So definitely good results we do see with the laser treatment for hair. But for hair graying, laser treatment won't give benefit. See, hair graying is multifactorial. Sometimes it can be age related, but those who are having hair graying at a younger age, maybe there is a family history or a vitamin deficiency or stress is a causative factor. So we have to rule out any underlying causes of this hair graying and treat accordingly. And with the treatment, what the specialists give also, I won't say a dramatic change can be there. What I can say is the hair graying can be stabilized to a greater extent, and at least 15 to 20% of the hair can be recovered, but majority of the hair, like 80 to 80%, will still remain gray. It is also important to check out vitamin deficiencies and also thyroid imbalance when early graying is there. So there is, answering your question, there is no laser treatment for hair graying, but definitely hair growth can be treated with lasers. So one person is asking how to do home remedy for taking care of skin. I've already explained all that before, how to take care with the cleansing, with the moisturization, and also using good sun protection, as well as using serums. I won't suggest too much of hair face mask or packs, because depending on your type of skin, fruit-based packs and all is beneficial. Try not to use very irritating ingredients on your skin, and don't try whatever gimmicks you see online, because it can have adverse effects. So next person, Miss Ruby, has asked how to remove dandruff. Now, in order to see, there are a lot of factors. There are different types of dandruff. So it is important that you consult your dermatologist so that they can assess and find out what type of dandruff you have, and depending on that, suggest the treatment. But in case you have the loose powdery type of dandruff, it's mostly because of a fungal element. So keeping your scalp and the hair clean is very important. Try to wash at least daily or alternate day with a mild shampoo. In case dandruff is there, use a mild anti-dandruff shampoo. And if in case it is very severe, mostly dermatologists would advise tablets along with it, depending on your state. So let me see more questions. Now, how to treat balding process? So see, like balding is mostly genetic. If there is a genetic family, like the father has balding, or there is balding in the mother side of the family, that is commonly happens. So depending on the stage of balding, we need to treat. So since it is a genetic thing, it is not something we can remove totally with medicines, but we can keep it in control and delay the process totally. So in an early stage, and if you are consulting the dermatologist, you'll be checked with a dermoscope or a skin surface microscope, and the hair will be assessed thoroughly. Now, if there is an early stage of thinning, or it can be helped with medicine, definitely your dermatologist is going to recommend medication. Most commonly, the medication which is given for balding is minoxidil. So depending on the concentration which the dermatologist give, you have to consult for that. That can be given. It will delay the process of balding at least by 70 to 80%, and that is very important. Now, in case the dermatologist examines and finds that amount of thinning is there, the hair is looking sparse and it is scanty, then they might suggest more on top of medication procedures like PRP therapy or growth factor concentrate injection. PRP means platelet rich plasma therapy. For example, if your blood contains platelets, so those are the wound healing cells. So what is done is your own blood is taken, it is concentrated, this growth factor is extracted, and they are injected back into the scalp at the level of the root. So that will help to give more strength to your hair, increase the volume of hair, and stabilize the hair fall also. So nowadays, in the last 1-2 years, a new thing has come which is called as growth factor concentrate, which has more potent growth factors, and that will also help to stabilize the thinning. And this is not separate from the medicine. It is to be used on top of the medical management which your dermatologist prescribe. And in case it is more severe kind of thinning what you are noticing, then mostly the dermatologist suggests you to undergo hair transplantation. So Suparna is asking for dry skin home remedy. For dry skin at home, as a home remedy, you can use coconut oil. I think that is the best out of all the oils to use on your skin. But as such, I would suggest you to use a chemical-free moisturizer. Very good ones are available, which is scent-free and white thick moisturizer. So that will help to take care of your skin. And don't bathe in too much hot water, which will again strip your skin of all the natural oils. Bathe in lukewarm water. Pat dry your skin, and within 2 to 3 minutes itself apply the moisturizer so that it locks in the water content. Okay. So Amanpreet is asking, is there any medicine for gray hair and a special diet to prevent gray hair? See, sometimes it can be a thyroid imbalance which is triggering out the graying or stress, or it can be like a special diet means more of iron rich or vitamin rich diet can be taken. There are medicines for graying of hair. Calcium pantothenate based medicines, but that should be given with your dermatologist's recommendation. And even serums are there which even contain curry leaf extract and all. When you apply on scalp, that will help to stabilize the graying process. I would suggest that please don't use any other remedies which you see online. Better to consult your dermatologist. The minimum duration of treatment is at least for a minimum duration of 6 months. So when you do that, as I have told before, you might get around 15 to 20% improvement. I will never say that all the gray hair is going to become black again, but at least it will stabilize the fast graying of hair. Now, Mudita Rastogi is asking any treatment for blemishes. So yes, there are treatment for blemishes. It depends on the kind of blemish you have, whether it is acne or any other marks or pigmentation because of any irritation or rashes or any injury. Yes, there is treatment for blemishes. And see, for example, if a blemish is very superficial, it is light color, dark marks which you are having, it can be still treated with but creams, I won't say will remove it totally and very fast also, because it has a minimum depth to which it can penetrate. And when you use cream, you have to be very, very patient. You have to use creams at least for a minimum duration of 5 to 6 months to get a good improvement. Now, if the pigmentation is a bit more deeper, then that is when we might resort to using of chemical peels and all, which would cause a bit of desquamation of the upper layers of skin, and that will also help in lightening of the mask. And if it is a very deep kind of pigmentation, it is in the deeper layers of skin, then better to consult your dermatologist. Maybe they will suggest laser treatment to remove the blemishes. So yes, it is possible to remove the blemishes very well. Now Mr. Tushar is asking, what is the option when minoxidil fails? Now, see, minoxidil is the only FDA approved serum for hair thinning. So, I'll suggest that definitely you should be using it. Now, in case you're not seeing any improvement with medical management and minoxidil is not, there are not improving, there are other options in medication which you can consult with your dermatologist and take. But the second option I'll suggest to is to add on a PRP treatment or a growth factor concentrate injection so that it will help to boost up the volume. Now, PRP treatment, it should be done once in a month for 6 months, and later on, you can have a maintenance session once in 3-4 months to maintain the volume you have achieved through the sessions. If it is growth factor injections, you can do it once in a month for 3 months, because as I said before, it is much more potent than PRP injections. So these are the options. But in case you have more degree of balding and more of empty spaces on your scalp, so when you consult with your dermatologist, if they're seeing more of empty spaces and more amount of thinning hair is there, then better to go in for a hair transplantation procedure. Now, hair transplantation means it is relocating the permanent roots. For example, you know that the back area hair is permanent roots. Even in a 70 or 80-year-old person who is fully bald, you know that that hair is permanent. At least 5 centimeter above attachment of ear going behind this area, the hair roots are permanent. Like a beard root, like your chest root. So they are taken through a procedure known as FUE or FUT and transplanted or shifted to a location which makes a cosmetic difference to the person. So it gives an excellent result. But one thing to understand is that transplanted roots are permanent, but your existing hair is not. So the empty areas can be filled with transplanted hair, but the thinning hair should be with medical management as well as treatment like PRP, and that is required to maintain. So it's a balance between your existing hair as well as the empty spaces, which is going to be refilled. Like for example, you have 100 hairs on your scalp and you're putting in 100 hairs through transplantation. The 100 hairs put in through transplant is permanent roots, but the existing hair can still undergo thinning. So that should be, that's why medical management is very important. So combine both. That's what I would suggest. Now, Mr. Vinay is asking, how frequently should we apply sunscreen? I'm a fieldwork employee entire day. I'm outside. So you're facing sun exposure in all seasons. Okay. So I've told this answer before. It should be applied at least 20 minutes before you get out into the sun. Since you're a fieldwork employee and you're getting a lot of sun exposure, better to use a minimum of SPF 50 plus sunscreen. Reapply one or two times during the day. For example, if you're applying at 9 o'clock, reapply it again at around 1 to 2, and reapply at least before 6 p.m. one more time. And if you are like really exposing to lot of sun, then better to apply it at least every 2 hours, so that will give a good protection and prevent tanning. So Mr. Samir is asking, ma'am, can we use moisturizer for acne prone skin? Yes, definitely we can use, because some people, we even see that the dry skin is there and along with that acne is also there, and also the treatment for acne does tend to dry out the skin a lot more. So better to use a moisturizer. But for acne prone skin, we won't recommend any thick kind of creams which can clog the pores. Better to use a gel based or lightweight moisturizer which does clog the pores, and you can get your dermatologist recommendation. So gel based moisturizer is the one which I would suggest. So which essential vitamins to take for glowing skin? So vitamin C, I'll say it's the most important vitamin for glowing skin. Also, you can take a diet which is rich in B12 also for glowing skin. As I said before, citrus fruits contain a lot of vitamin C. You can even take vitamin C tablet in order to boost your skin glow. Now, at the age of 27, is it safe to use minoxidil? Yes, definitely, Mr. Yesh. Your question is good. So it is safe to use minoxidil. Sometimes nowadays we are seeing maybe because of a lifestyle change and all, there is increase in a balding process even up to a very younger age. We do consult patients who are having thinning on the scalp at an age of 16 or 18 years, and whenever we see early sign of thinning, that is a time we have to introduce minoxidil. At least it will stabilize and delay the process of balding and help in retaining your existing hair. So even at an age of 20 it is safe, so 27 is definitely a safe age. Now Suresh is asking, is OTC product for fall good? So see, I think you are meaning hair fall. So what I'll suggest in the case of OTC products, see, I won't suggest any hair oil, because oil is definitely not going to stabilize your hair fall. That is scientifically proven. First of all, we need to rule out any underlying conditions which is trigger out your hair fall, like any vitamin deficiencies, or whether it's stress, any shampoo which is sulfate based or highly rich in chemicals which you have been using. So I'll suggest get in touch with your dermatologist who will rule out any underlying causes, and check your scalp whether you are having more of thinning or hair fall. So these are two different mechanisms of action, so that should be identified and the product should be suggested accordingly. But in case you are picking up a product over the counter, I'd suggest you to pick up a shampoo or a conditioner which is SLS free or parabens free, and that will help to protect your hair. So now Mr. Ashok has asked, which is the best treatment for skin whitening? So see, I'll say that you should be happy with your own skin color, and what I'll say is the skin can't be whitened. You can achieve your lighter skin tone. That is by prevention of tanning and reduction of pigmentation by using creams. There are creams which contains acidic ingredients like kojic acid, glycolic acid, arbutin, etc., which your dermatologist will prescribe to you after examining your skin thoroughly. If the pigmentation is more deeper, you have photopigmentation, that is pigmentation over the forehead areas and all, or on the cheek areas, better to resort to something more deeper, because the pigmentation will be difficult to take care with the creams itself. So maybe the dermatologist will suggest, and definitely lasers is excellent option. We see very good results with the lasers when you see a lot of people nowadays are using coming to us asking for lasers instead of doing facials, because skin rejuvenation and glow can happen even before going for a function or a party. A lot of people do come to us asking options like lasers. So it is very safe. It is FDA approved to use on your skin. So along with your skincare regimen with lightening active ingredients to be used at night, you have to use sun protection, and along with that your dermatologist recommended treatments also. Now Mr. Amardeep is saying, ma'am, after stopping use of minoxidil, hair fall increases. How to take care? So see, minoxidil, once you start out on it, one thing to understand is we are treating a balding process, and a balding process is genetic. Now, can we stop genetics with medicine? It can't be. So when you start using minoxidil, you should keep it mentally in your mind that you are like treating it like watering a plant. When you stop watering, definitely the plant dies out. So similarly, you should be using minoxidil. It should be a regular use, like brushing your teeth. It should be a lifestyle change, like how somebody takes medicine for diabetes or BD or thyroid or cholesterol. It requires a lot of lifestyle changes. So similarly, that is how you should be using minoxidil. So once you start using, at least it can stabilize 70 to 80% of hair on your scalp. And I'll always tell my patients how to use minoxidil is, I want you to, as long as you want to retain your existing hair. See, for example, you have used it for 1 year, it has retained at least 100, 200 hairs on your scalp. You have to understand this 100, 200 hairs is there on your scalp only because you're using this medicine. So what happens? The minoxidil is increasing the blood supply, increasing the nutrition to the scalp, and helping the existing hair stay there for longer. But what happens when you stop using minoxidil? This blood supply decreases, the nutrition supplied to the hair decreases. So the hair which has been maintained by minoxidil always has a tendency to go. So since it's a genetic process, I'll suggest to use it like a lifestyle change, and minoxidil should be stopped. So in case you have more amount of hair fall, please consult your dermatologist because they can examine with a dermoscope and suggest you which treatment you can follow. Ms. Nandini is asking glutathione can be used. See, glutathione is become very famous nowadays, specifically because a lot of film stars have been using it. One thing about glutathione I'll say is the safety profile is still being researched. Second thing is it will give a complexion change, it will give a brightening and glow when you're using the medicine, and it's not retained once you stop it, so it's not you can take it lifelong. So somebody who has a function or a wedding to attend, or their wedding is happening, then just before that, in order to get a glow, maybe glutathione tablets can be taken, and that's how I'll suggest it. So Mr. Yesh is asking, should I use minoxidil alone or with any combination? So nowadays a lot of combination of minoxidil is available with finasteride, with aminexil. So I'll suggest that these combinations give a very good result, but your dermatologist should examine your scalp and recommend accordingly. But definitely it does give a very good result. So I guess I have covered mostly all the question. I'll just scroll through this and see whether I've missed anybody's questions. So one more question is there. Mr. Raj is asking how to prevent skin tan overexposure to sun, especially on neck, hand, like sun exposure areas. So yes, it's a very important question. See, it's not just a face that you have to protect, otherwise you will be have different shades. You have to use sunscreen also on the neck, even on the arms also sunscreen is important. But in case you're going out into a sun a lot, try to use a shawl to cover that areas, try to use full sleeve, and you have to reapply the sunscreen mandatorily. And see, the cosmetic type of sunscreen, or the dry touch sunscreens or gel based sunscreens are more expensive. You can use it on the face, but you can in the neck area, on the body parts and all, you can use a lotion which contains SPF or a moisturizing lotion, etc. So that would be good. And if there is suntan or which is happening, then your dermatologist would be able to recommend to you a cream with containing lightening acids like kojic acid, glycolic acid, etc., which will improve the pigmentation. So yes, how to get rid of silt deposited on the neck. So I don't understand what you mean by silt. Do you mean by skin tags or any black kind of things which is there on the neck? If that is what you're meaning, skin tag is something which is genetic, so there is no cream to remove it, or there is no kind of tablet which we can give in order to prevent it. So since if you have many and it is affecting the cosmetic appearance of the face, it can be removed through a procedure known as electrocautery. So it is not at all a painful procedure. It is done after using numbing cream. So whatever the outgrowths are there, it can be removed through this procedure, and there won't be any residual marks also. So I'll suggest you go and consult your regular dermatologist. So thank you everyone. Mr. Bibin has asked, can you suggest further contact details if anyone wants to reach out for consultation? So if you Google my name, Dr. Niranjana Raj, you can see options to consult online also. Also, you can get in touch through our Facebook page or Instagram page, or even you can clinic landline number like triple 888 425 4545. So you can connect that, and staff will guide you how to connect to us. Right now, because we are all practicing social distancing, we are all at home. The clinic is not open right now, but they will get in touch with you and explain to you how to get a consultation going. So the phone number is 888-425-4545. You can also Google Yogiraj Center for Dermatology, Bangalore, and there you will get our contact details. So again, I'll repeat, it is Dr. Yogiraj for Dermatology and Cosmetology, Bangalore. So I hope this has been informative. One more question is there. So Mr. Vinod has asked how to cure eczema for 1-year-old child. See, eczema is very difficult to get it totally cured, but we can get it under good remission. I'd suggest the most important thing is not to use any chemical-based soaps on the skin. Use mild, gentle cleanser, and the important thing is to moisturize. You have to repeatedly moisturize in order to maintain the skin at least 4-5 times a day if it is possible. That will help to maintain under remission. But in case any rashes is coming, get in touch with your dermatologist. They will prescribe to you a proper skincare regimen, so which you can use as and when it is required. So make sure the skin is thoroughly moist, and that will decrease this process. And sometimes this kind of atopic tendency or eczema tendency does decrease with age once a child grows older. But moisturization using chemical-free products, white non-scented soap and all are very important in maintaining this. So I guess we have come to the end of our session. So thank you all for a patient listening. Thank you all. I hope this has been very informative for you. Okay, bye. Take care.